So in this section, we'll be discussing the whole procedure of the autopsy that is performed. Autopsy, as we have already discussed, is the post-mortem examination, the examination after death to the body. In this section, we'll be dealing with the preliminaries to an autopsy, the examination of the death scene, the post-mortem estimation, and the identification of the dead person. Now, the preliminaries to an autopsy procedure. Obviously, there should be an authorization and consent of the relatives, of course, and it is basically depending upon the rules of the state that we are carrying out the procedure in. Who may be present at an autopsy room? That is the mainstay. Relatives, in some cases, basically they allow the relatives to be present at an autopsy room, but in mostly they are not. Basically, it is unethical to basically call the relatives inside an autopsy room. Examination of the scene of death. To assess the environment, local circumstances, position, and the condition of the body. Now, this is the mainstay while we are getting the examination of the scene of death. The environment, the local circumstances, the positioning of the dead body, and the condition of the body. It should be noted vaguely and roughly by the medico-legal officer who has to perform the autopsy. Now, appropriate equipment, which is known as the murder bag. Now, the murder bag should have the gloves, the apron, which is the waterproof apron, the funnels, the disposable bags, the jars to collect the samples, and there should be gloves along with him. He should be carrying a digital camera, a notebook to write down the specific findings of the environment along with him. So there are certain typical equipments that has to be carried out in a murder bag. There has to be a specific body bag which is carried out, which he has to carry along with him to seal out the dead body, and not to hinder the trace evidence which has to be basically preserved by the medico-legal officer. Now, the cause of death should be observed. Of course, he should be observing the surroundings and he should be making his own views. What was the cause of death? What caused the death of the person? Whether it was a syncopial death, whether it was a comatose death, or whether it was an asphyxial death. Now, the blood pools or splashes are noted in relation to the position of the corpse. Now, this is very important. Now, I'll explain it in detail. Basically, what happens here is, if there is a perpendicular splash to the dead body, the splash formed is basically of a circular type. And whenever there is an oblique splash of the blood in relation to the body, then there is an exclamation mark type splash of the blood found. So this is basically these splashes, and these blood pools are noted in detail by the medico-legal officer who is visiting the site. Now, such type of the shape of the splashes are noted and they should be observed in detail, of course. And the equipment for the scene of crime investigation. As I've already told you, there is a special type of equipment. What does it contain? It basically contains the apron, the waterproof apron, the rubber gloves, the overall and the mask. Then the thermometers, syringes and needles, and there are sterile swabs, of course. Moving on, there should be an autopsy dissection set. There should be a handsaw along with him for the bone cutting procedures, etc. And there are cutting needles and twines for the body closure to basically give a cosmetic view before handing over the body to the relatives. Now, the swabs and the containers for the body and the body fluids for sending the specimens to the chemical pathologist. Now, formalin jars for the histological samples, plastic bags, envelopes, papers, spare pens and pencils, just to note down the findings of the crime scene. The printed body charts for recording the external injuries, of course. The hand lens, the electric torch, the digital dictaphones and the mini tape recorders. All of these things, they have to be carried out in the murder bag that I was referring to. The digital or 35mm single lens reflex camera with electronic flash or digital video cameras. Now, it is an example of a post-mortem interval at the crime scene. Now, basically, what are we going to notice down over here is the position of the dead body, the surroundings. What can be the cause of death in such a case when she's dealing, the knife is present over there on the slab and she's lying flat on the floor of the kitchen. And all of these surroundings have to be observed by the medico-legal officer who is visiting the crime scene. And they have to be noted down and jotted down along with all these equipments that he's carrying along with him. Now, this is how the sketching is done. That was the crime scene that he basically went on to, and then he sketched down everything in detail: the date, the name, the identification of the person by the people present over there, the time when he visited that place, the address, the age of the person, if it can be sorted out, and the sex of the person, of course. The injuries on the body should be matched up with the damage on the clothing. The tears, the slashes, the stab wounds, and especially the firearm wounds in the clothes, they have to be noted down in detail. Self-inflicted wounds may be confirmed by the non-alignment of the clothing damage with the injuries. Blood, seminal, vaginal, and other body secretions may be found, and basically they give a pointing out towards the cause of death. The gunshot residues, they are a mainstay to the trace evidence found at the crime scene. The grease marks, the road dirt, broken lamps, if they are found in the vicinity, the windscreen glasses, metallic or any paint fragments that can be found at the, basically all the trace evidence that is to be found out at the crime scene. It has to be calculated. It has to be collected in the jars, in the bags that he has taken along with them, and they have to be sent to the chemical examiner. Now, the identification of the body. As I've already told you, the mainstay, the main objective of the autopsy procedure is the identification of the deceased person. The body may be fresh and intact, and the identification is very easy in such cases. It can be putrefied. Now, in a putrefied bodies, the identification becomes very hard because the body is quite debilitated. It cannot be identified on a single view, even by the relatives. It can be mutilated or dismembered. It can be charred in burnt cases. Of course, it can be a charred body. There can be a mass disfigurement to the body. It can be skeletonized, and all of these cases, all of these bodies have to be identified after the post-mortem examinations, of course. So in this section, basically, we summed up the whole procedure whenever the medico-legal officer is visiting a crime scene. What are basically the equipments that he should be carrying along with them? What is the kind of sketching that he's supposed to do? And what purpose is behind all these sketching and all these purposes. So there is a complete external examination to the crime scene, and it has to be done in quite detail. So this is the end of this section. Thank you for watching sqadia.com.